In this video, we can discuss about pharmacology of oral contraceptive or hormonal contraceptives. It's an important topic from pharmacology of drugs acting on hormonal disorders. In this, we will discuss the definition of hormonal contraceptives, different types of hormonal contraceptive preparations like oral as well as injectable contraceptives, mechanism of action, adverse drug reaction, drug interaction, and contraindications of oral contraceptives. So let's start with the definition of oral contraceptives. These are the hormonal preparations which are used for reversible suppression of fertility, which means preparation which are used to prevent unwanted pregnancy. And usually the oral contraceptive is also known as the pills, since this is the most popular method of contraception among the female. Now coming to the type of hormonal contraceptives, hormonal contraceptive may classify into two, oral and injectable contraceptives. And oral include combined, phase pill, postcoital, and progestin or mini pills. So what is meant by oral hormonal contraceptives? As the name indicates, these are the hormonal preparation which are effective through the oral administration for the reversible suppression of fertility or to prevent unwanted pregnancy. And there are four types of oral contraceptive pills. First one is combined pill, phase pills, mini pills or progestin only pills, and postcoital pill or emergency pill. Let's discuss one by one. First one is combined pill. As the name indicates, this is a combination of estrogen and progestin in a fixed dose for all the day of treatment cycle, that is 21 day of treatment cycle, 21 or 28 days of treatment cycle. This is usually used as a monophasic because in all the phases of 21 days we will take fixed dose of combination of estrogen and progestin. Now what is the use of estrogen in this combined pill? Estrogen will inhibit the follicular stimulating hormone release, which is essential for the ovarian follicle development. Usually synthetic estrogen like ethinyl estradiol 30 microgram is used in this combination. Then progestin is used to decrease the luteinizing hormone secretion, which is essential for the ovulation, and they will also reduce mid-cycle surge, and they also will modify the cervical mucosa and make it thick in such a way that which is unsuitable for the sperm penetration. So synthetic progesterones like norgestrol 0.3 milligram, levonorgestrel 0.25 milligram, desorgestrel 0.25 milligram. Any one of these progestin can be used in combination of progestin as well as estrogen combined pills. Now what is the mechanism of action to prevent the pregnancy in case of combined pill? So we will use both estrogen as well as progestin. So this will synergize to inhibit the ovulation. So if there is no ovulation, ovum will not combine with the sperm and it will not produce a zygote. And progestin will ensure prompt bleeding at the end of cycle, and it will block the risk of developing endometrial carcinoma due to the estrogen. Now how we will administer the combined pill? We will take one tablet daily for 21 days starting from 5th day of menstruation, and the next course of 21 tablet will start after the 7 days in which bleeding occur. Thus total of 28 cycle will be maintained. So that is the method of administration of combined pill. Now coming to the benefits of combined pill, this is effective. Success rate is 98 to 99.9%, which means we can prevent 98 of 100 women who are taking combined pill. We can prevent the chances of pregnancy in 98 women or 99.9% women out of 100 women who are taking combined pill. And this is safer for the consecutive use, and there are some positive menstrual effects, like it will decreases the cramp, it will decreases the blood loss, and it will reduce the premenstrual symptoms. But there are some limitation. It must be taken daily, should not be missed, and these are expensive, and it will not give protection against a sexually transmitted infection, which will given by some physical barriers like condom. And it have some side effects like missed periods, nausea, vomiting, headache, depression, and decreased libido. So these are the limitations of combined pill. Now coming to the second class of oral contraceptive, that is the phased pills. As the name indicate, in this we will use 3 phases or 2 phases for the treatment. Usually we will go for triphasic regimen, which is introduced to permit reduction in the total steroidal dose without compromising the efficacy by mimicking the normal hormonal pattern in the menstrual cycle. Now, what is the difference between phased pill and monophasic pills or combined pills? In phased pill, we will keep the concentration of estrogen constant, like ethinyl estradiol between 30 to 40 microgram, and we will change the progestin concentration from low to higher, from first to first. So the progestin concentration will be low in first phase, and we will increases the concentration of progestin in second and third phase. So we will understand what is this phased pill. I'll discussing this example. So this levonorgestrel is used as an progestin, synthetic progestin, and ethyl estradiol is used as an estrogen. So we will keep the concentration of estrogen concentration in all the 3 phases. Suppose in first 6 days we will use ethinyl estradiol 30 mg and levonorgestrel 50 microgram, and next 5 days we will keep 40 microgram of ethinyl estradiol and 75 microgram of levonorgestrel, and last 10 days we will use 30 microgram of ethinyl estradiol and 125 microgram of levonorgestrel. So there will be a total of 21 days cycle. Now in case of norethindrone, we will use 0.5 mg in first 7 days along with the ethinyl estradiol 35 microgram in first 7 days. Then next 7 days we will use norethindrone 0.75 milligram and ethinyl estradiol 30 milligram combination, and finally last 7 days we will use 1 milligram of norethindrone and 35 microgram of ethinyl estradiol and last 7 days. So total of 21 days cycle will be completed. So this is the difference between phased pill and combined pill. In this we will keep the concentration of estrogen constant, and we will increases the concentration of progestin from low to higher from first to third phase. Okay. Now this phased pill is particularly recommended for the woman over 35 years of age and for those with no withdrawal bleeding or breakthrough bleeding while using monophasic pill, or when other risk factors are present. Now, what is the mechanism of action of phased pill? It will produce a thick cervical mucosa. So by changing the thickness of cervical mucosa, it will prevent the sperm penetration. So fertilization will not occur. So that is the mechanism of action of phased pills. Now coming to the third class of oral contraceptive pills, that is the mini pill or progestin only pill. Here we will use only progestin with low dose, which is taken all the days of treatment cycle of 28 days without any gap. So we can use norethindrone 0.35 mg or norgestrel of 75 microgram. Any one of these synthetic progestin will be used in low dose for all the days of treatment of 28 days without any gap. And this mini pill is devised to eliminate the estrogen. Estrogen have some long-term risk. So this is the one of the benefit of the mini pill. This is estrogen free, so it will tolerate the effect of combined pill, or it is for or who are contraindicated against taking estrogen containing preparation. And also another benefit is this is safer during even lactation also. Now, there are some limitations. First one is menstrual irregularity. The menstrual cycle may change and it may tend to be irregular, and ovulation may occur in 20 to 30% women. And efficacy is lower when compared with the combined pill. It is 96 to 98%. So this is not used regularly nowadays due to its failure. Up to 2 to 4% failure is there. So we are not using these mini pills nowadays. Now, coming to the last type of oral contraceptive pills, that is the post-coital or emergency pills. So, we had discussed the combined pill, phased pills, and the progesterone only pill that we are taking for 21 days before the intercourse. So, in case if a woman is not taking oral contraceptive and who had a sexual intercourse which is risking unwanted pregnancy, in that case we can use this post-coital or emergency pill. But there is one limitation: it should be taken within 72 hours of intercourse. So there are four types of post-coital emergency pill. First one is yes method. In this we will use two doses of a combination of levonorgestrel 0.5 milligram and ethinyl estradiol 1 milligram at an 12-hour interval within 72 hours. So we have to take two doses within 12-hour interval within 72 hours of intercourse. Now, second method is we can use levonorgestrel 75 mg alone, which is taken twice within 12 hours of gap, or we can use 1.5 milligram of levonorgestrel single dose, which is taken at a time within 72 hours of unprotected intercourse. Usually this method is 2 to 3 times more effective and better tolerated than yes method. So that is the second method. Now coming to third one, we can use mifepristone, which is an anti-progesterone drug, 600 mg single dose as soon as possible within the 72 hours of intercourse. And another progestin modulator, that is ulipristal 30 milligram single dose as soon as possible within 120 hours of intercourse. So these are the different post-coital or emergency pills. So that is all about the different types of oral contraceptive pills. Now coming to the mechanism of action of hormonal contraceptives, there are 5 different types of mechanism of preventing pregnancy in case of hormonal contraceptive. Let's discuss one by one. First one is inhibition of gonadotropin release, which means they will inhibit the release of follicular stimulating hormone and luteinizing hormone from the pituitary by reinforcement of normal feedback inhibition. So by this action, the progestin will reduce the release of LH secretory pulse and estrogen will reduce the FSH secretion. So by the decreasing LH and FSH secretion effect, follicles may fail to develop and it may fail to rupture. So what will happen? There will not be any ovulation. Ovulation will not occur. So if there is no ovulation, ovum will not be produced. So there will not be any ovum to fertilize with the sperm. So fertilization also will not occur. Now second mechanism is by the action of progestin, they will produce a thick cervical mucosal secretion. So what will happen? It will prevent the sperm penetration. So if there is no sperm penetration, it will not combine with, there will not be any sperm to combine with the ovum to fertilize. So there will not be any zygote formation. This will be in case of combined pill, phased pills, mini pills. Now coming to the third mechanism. Now, even if ovulation and fertilization occur, now if we are using at that stage, we are using mini pills or post-coit pill, the blastocytes, these are the distinctive stage of mammalian embryo, which may fail to implant because of the endometrium is either hyperproliferative or hypersecretory or atopic. So all these three stages are not suitable for the implantation of blastocytes, which is already fertilized. So that is another mechanism in case of mini pills, postcoital pills. Now, another mechanism is uterine and tubal contraction may be modified to disfavor the fertilization, just in case of mini pills as well as postcoital pills. Now, in case of postcoital pills, it may force out a just implanted blastocytes, or it may interfere with the fertilization or implantation. So these are the different mechanism of actions of hormonal contraceptives to prevent the unwanted pregnancy. Now, while comparing the effect of the combined pill, mini pills and postcoital pills, we can find that the inhibition of FSH is more in combined pill when compared with the mini pills and postcoital pill. Now, in case of inhibition of luteinizing hormone secretion, it is more in case of combined pill when compared with the mini pills. And in ovulatory effect, combined pill have more effect than mini pills as well as postcoital pill. Now, to make the cervical mucosa unsuitable for the penetration, it have more effect on combined pills, and it has almost same effect in mini pills also. And in overall, while we are comparing the failure rate, which means the number of women, the number of chances of pregnancy in 100 women, the failure rate is 0.1 to 0.3. It is very less in case of combined pill, and there will be a chance for failure up to 2 to 3, which means 2 out of 100 women can be pregnant while taking mini pills. So in overall, we can resume or we can conclude that oral contraceptive efficacy of combined pill is more when compared to mini pill and other postcoital pill. So it is the most safest oral contraceptive pills, combined pill, by using a combination of estrogen and progesterone in a fixed dose for 21 days. Now, these are the some marketed products in of different oral contraceptive preparation. In combined pill, we have Malady, which contain norgestrol and ethinyl estradiol. Then overall, which contain levonorgestrol and ethinyl estradiol. Then Novolin, which contain norgestrol and ethinyl estradiol. All these are 21 days tablets except the Malady, which is 21 days plus 7 ferrous sulfate tablet also is there. Now, in case of phased pills, we can use either levonorgestrone and ethinyl estradiol with three phases. First phase we will use 50 and 30. Second phase we will use 75 and 40. And third 10 days we will use 125 and 30 days. So that is the phased pills. Now in case of postcoital pills, we have overall and eye pill and mini pills like Overaton and Micronor. These are the some brand or trade names of some marketed oral contraceptive preparations. Now coming to the adverse drug reactions of hormonal contraceptives, it may produce three different type of adverse drug reaction in the sense of their intensity. First one is non-serious type. It may produce nausea, vomiting, which are similar to the morning sickness in case of pregnancy. Then usually the headache is mild, but migraine may be precipitated or worsened by using oral contraceptive. There will be some chance for breakthrough bleeding or spotting. Now, there are some adverse drug reaction which will appear later after finishing the use of hormonal contraceptives, like there will be some weight gain, acne and increased body hair, then chloasma, which is the pigmentation of cheek, nose, forehead, and there is a chance for diabetic mellitus because there may be some carbohydrate intolerance, so it will precipitate the diabetics in few subjects. Now, there are some serious adverse drug reactions like leg vein thrombosis, pulmonary embolism and pulmonary thrombosis, coronary and cerebral thrombosis which may result in myocardial infarction. There will be some rise in BP. Then estrogen may tend to rise the plasma HDL and LDL ratio, which is beneficial. But while using combined pill, the beneficial effect of estrogen may be nullified by the progestin, and it may cause some genital carcinoma, benign hepatoma, and gallstone. So these are the different serious type of adverse drug reaction while using hormonal contraceptive pills for long term. Now coming to the contraindications, in these are the some of the patient in which we have to take precaution while using our contraceptive pills. The patient who have thromboembolic, coronary and cerebral diseases or have its history of these diseases, and patient who have moderate to severe hypertension, patient with hyperlipidemia, patient with active liver diseases, hepatoma or history of jaundice during the past pregnancy, patient with the suspected or overt malignancy, genital or breast, and patient with obesity and diabetic mellitus. So these are some patients in which we have to take precautions. Now coming to the drug interaction. The drug interaction is very important because if you are using oral contraceptive pills with some of the drugs, it may cause oral contraceptive failure because of two action. First one is enzyme inducer. Some drugs like phenytoin, phenobarbital, primidone, carbamazepine and rifampicin and ritrodin, all these are enzyme inducers. So what will happen? They will increases the metabolism of estrogenic as well as progestinational component. So what will happen? It will fail, or there will not be sufficient amount of estrogen and progesterone in the body. So it may lead to oral contraceptive failure. Now another mechanism is suppression of intestinal microflora. Like if you are using antibiotic like tetracycline and ampicillin, it will produce deconjugation of estrogen excreted in the fail in the bile may fail to occur. So this is a method of metabolism of estrogen. So this deconjugation of estrogen may fail. So their enterohepatic circulation is interrupted and thereby their blood level may fall. So it may also lead to failure of contraceptive pills. So this is all about the hormonal contraceptive pills. Now there are some other type of hormonal contraceptive like injectable hormonal contraceptives. Usually these injectable contraceptive pills are developed to avoid the need of daily injection of the pill. So as we mentioned before, oral contraceptive pills have to be taken under 21 days. So in order to avoid that, we can use these injectable oral contraceptive pills which are given IM route as oily injection, and we can use only long acting progestin which is injected nowadays, and in this we can inject once, we have to inject once in 2 to 3 months instead of taking daily oral contraceptive pills. That is the advantages. We have to inject once in 2 to 3 months depending upon the steroid. But there are some limitation, first like menstrual irregularities, excessive bleeding and amenorrhea, and this incidence of amenorrhea may increases with the increasing duration of use. And there is one another limitation. The animal data indicated some carcinogenic potential, but there is no proof for human studies. Now these are some examples of injectable contraceptives which are usually injected as deep IM injection during first 5 days of menstrual cycle. And first example is depot of medroxyprogesterone acetate 150 mg at 3-month interval is injected. So after the IM injection, the peak blood level are reached in 3 weeks and it will decline with the half-life of 50 days. And another example for injectable contraceptive is norethindrone or norethisterone ethanate 200 mg at 2-month interval. So that is the advantage of injectable contraceptive pills. We have to take 3-month interval or 2-month interval instead of taking 21 days of oral contraceptive pills. Now coming to another type of contraceptive, that is implant contraceptive. So these are the drug delivery system which are implanted under the skin from which the steroid is released slowly over a period of 1 to 5 years. That is another advantage. We don't have to take contraceptive for a period of 1 to 5 years by using implant contraceptive. But we may have to use either a biodegradable polymer matrix or non-biodegradable rubber polymers to formulate the implants. So if you are using biodegradable polymer matrix, we don't have to remove on expiry because they will degrade automatically. But in case of if we are using non-biodegradable rubber material for formulating the implant, we have to remove on expiry because it will not biodegrade in our body. Now these are some examples of implant contraceptive. First one is Norplant, which is a set of 6 capsules, each containing 36 milligram of levonorgestrel. So total of 216 milligram of levonorgestrel, which is implanted subcutaneously, and it can work up to 5 years. But this is discontinued now in USA. Now another implant is Progestin. Okay, Progesta. So these are the implant which are inserted intrauterинally. Progesterone impregnated intrauterine insert which containing 52 milligram of levonorgestrel, which is primarily act locally on endometrium, and this device can remain up to 5 years. So that is the advantage of implant contraceptive. It can work up to 5 years once we have implanted inside the skin. So we don't have to take the oral contraceptive for 21 days for next 5 years. So this is the mechanism of injectable oral contraceptives. It will inhibit the FSH release. It will inhibit the luteinization inhibition, luteinizing hormone, and also it will produce anti-ovulatory effects, and it will make the cervical mucosa thick, and it will prevent the penetration. And the oral contraceptive efficacy is same as that of combined pill also. But the limitation is we have to inject, some pain will be there. So that is the limitation. So that is all about the hormonal contraceptives. We had discussed about oral or hormonal contraceptive pills in detail, and some injectable as well as implant contraceptives. This is an important topic on exam point of view, which is usually seen as a short note question: pharmacology of oral contraceptive pills or hormonal contraceptive pills. Hope it is clear. Thank you for watching this video.